Hi, I'm Stewart and I run the ultrasound scan and ultrasound guided injection clinic at LifeFit Wellness. We've got a number of different injections that we use to treat osteoarthritis, and I thought it'd be useful just to go through these different options that we have available and explain a bit about the particular benefits and other things to consider with the injections. So starting with good old cortisone, also known as steroid or corticosteroids. And they come in this little vial here, but it's a very potent anti-inflammatory medication, and that can be injected directly into the joint to reduce typically high levels of inflammation. It's often also mixed with local anaesthetic. This is lidocaine. It can be a very effective anti-inflammatory, but it does have some significant considerations. In particular, if it's overused, it can actually, believe it or not, cause further degeneration to an arthritic joint. So we'd need to use this one in a considered fashion and sparingly if possible, but it can add value to a number of patients. Then we move on to hyaluronic acid products. And hyaluronic acid products provide lubrication and shock absorption inside joints. They are produced naturally within the joint, and it's the main constituent part of joint fluid or synovial fluid. And the premise is that it can be injected as a supplement to provide that additional lubrication and shock absorption to try and reduce pain in a symptomatic osteoarthritic joint. So as I say, we have a number of products with slight differences. This is basically the tried and tested market leader, been about for about 20 years and is known and trusted by many patients and clinicians alike. It's called Osteonol Plus, and as I say, it's a reliable product. But moving along, we have an alternative to that some people choose, and this is called Synovial HL. The proposed benefit here is that it has a slightly higher concentration of hyaluronic acid, and it's got two different molecular weights of hyaluronic acid, high and low, and that's meant to mimic the body's own native hyaluronic acid a little more closely, and therefore the theory is that it's better tolerated with better outcomes. We then have an interesting product here which actually combines the hyaluronic acid with the steroid. So here we've got Syngal, which has pre-mixed and formulated hyaluronic acid with a corticosteroid to give that dual anti-inflammatory and the mechanical lubrication and shock absorption. And then the final product we have is a relatively new one to the clinic that we've just started using called Synagel. And it's interesting because it takes the hyaluronic acid on a stage and it's mixed with something called sodium chondroitin. And that is meant to give a bit of increased shock absorption, so it creates a bit more kind of robustness to the solution that is injected, and it also has a slightly higher volume that goes into the joint as well. So that's the main products that we have available for injections to treat osteoarthritis in particular, with slight varying strengths, weaknesses, pros and cons. And if you have any questions about those, you can contact the clinic, or it's something that we take time to fully discuss with each patient following a full assessment.